pandemic has exposed in technicolour issues within our communities that we knew existed, but now we just can't ignore.
And in fact, for all of us really, COVID's had a profound effect on the amount of social contact that we get. And that's particularly true for people who are most vulnerable, because they're often medically very vulnerable as well.
A lot of people's mental health was, under a lot of pressure due to the lockdown, not seeing family, not seeing friends.
Our need for social prescribers has ballooned because of COVID. So patients who were previously vulnerable are now even more in need. They are more isolated, they're more lonely. We're living in challenging times. There's people that live on a 18th floor of a high-rise building that were unable to leave their flat and still haven't. So their only social connection is potentially with a social prescriber.
This pandemic has affected every area of life, and so all of the areas that we covered, like employment, benefits, mental health, carers, all of those have been highlighted even more. There are even more of a need now.
At the moment in our team, there's 8 of us now, so we've literally more or less doubled since the pandemic because there's such a need.
Social prescribing really moved into gear to become part of the critical response to coronavirus.
The pandemic was an opportunity for us to demonstrate what we could do.
And the fact that you could still connect residents to lots of different services and be supportive has been a really significant part of the service provision and very flexible part of the service provision.
I think social prescribing was important before the pandemic, and I think it has been really, really important throughout the pandemic and probably post once we leave and we go back to some normality.
I think social prescribing is going to be really important to help people who are in kind of like a housing crisis. Maybe they're going to be evicted. This can really affect their health and their mental well-being.
It has provided an opportunity for us to really highlight the fantastic need and niche that social prescribing has within London.
During the pandemic, it was heartbreaking, but it was also incredibly positive and optimistic to sort of see that everybody is actually coming together and letting people know that there is help out there and that we are looking after people.
We all need assurance one way or another. People need to know how they can survive this pandemic and how they're just having someone to listen to you and hold your hand, that you're not alone in this and you're going to get through this.
We've been able to find solutions for people and to give them options and to help them feel less alone and less isolated during this time.
And I think they have a really pivotal role in preventive medicine moving forward, for sure.
During the pandemic, that really kind of taught us what this role was and how important it is in the community. Something like this has never really been seen before, and I couldn't imagine a community without it now.
How has COVID impacted social prescribing? It's shown that the need for social prescribing is out there, it's bigger than ever, and the challenge is to find the services to provide those needs in people's communities.